Well, good afternoon, everybody. Happy Monday. Happy St. Patrick's Day. And I am very pleased to greet everyone today with our esteemed Director of Health and Human Services, Elizabeth Hertel, who also is wearing green, which I'm very excited about. And I'd like to give a brief introduction and some background on her and turn it over to her for her presentation. Elizabeth is the director, as I mentioned, of Michigan's Department of Health and Human Services. She previously served as Senior Chief Deputy Director for Administration, where she oversaw external relations and communications, financial operations, legislative services, legal affairs, policy planning, strategic integration, organizational services, and pretty much everything else in the department. We're very lucky to have her with us today. She joined the Department of Community Health back in 2013 and has served in a number of roles, both in the House and as well as in the department, and as in advocacy with Trinity Health Michigan. So her experience is very vast and deep throughout the state of Michigan and the legislative process. She earned her bachelor's degree at Grand Valley and an MBA from Michigan State University. So without further ado, I would like to turn it over to Director Hertel to get some words of wisdom for her and then ask a few questions when she's ready to take them. Hello, Elizabeth.
Hi, everybody. Good afternoon. I think that there is a slide presentation. Is that up? Can I just not see it?
It's up.
Okay. All right. Here we go. Now I can see it. All right. Happy St. Patrick's Day. Happy Monday. I'm glad the sun is out today, and I'm really grateful for the invitation to join you this afternoon and talk about some of the things that we have going on in the department. So, sorry, just one second. Today, I'd like to update you on some of the work that we are doing overall in the department, some of the investments that we're requesting for fiscal year 26, some updates on the investments that we had approved for this current fiscal year. And then again, of course, I can answer some questions when we have time at the end. So if you want to go to the next slide. I just want to level set. I think most of you know what we do at the department and some of the ways that we do interact with people all across the state through our many programs. We continue to focus on carrying out our mission to provide services and administer programs that work to improve the health, safety, and prosperity of the residents in the state. And I am personally very proud of what our employees and our partners, so many of you, have accomplished over the past few years, which includes our work collectively to strengthen the healthcare workforce, keep kids safe, and improve access to behavioral health care, as well as aligning with addressing social determinants of health. I am incredibly grateful for the continued support and dedication of so many to improving the lives of our friends, our families, and our neighbors in this state. This is just a quick snapshot of a few of the stats that we have on things that we've done. And I think we can get into a little bit more specifics now with the next slide. I know that probably many of you know that as director, one of my top priorities has been to increase access to behavioral health care. I feel very strongly that everyone should have access to care when, where, and at the level that they need it, which is why we continue to build a system where there is no wrong entry point for behavioral health care services. This has meant building from what we have to create a stronger array of services and resources for children and adults where we know that there are gaps. We as a state have invested and collaborated with many, many partners to strengthen our workforce and to increase those access points to coordinated, quality, and affordable care. I believe and we know that it is critical to have community-based services to address needs early and on an outpatient preventive basis. It's important that we have crisis stabilization services so that we can stabilize individuals and keep them out of emergency departments and potentially out of inpatient settings. And then alternatives to inpatient settings that are smaller and closer to people's homes through the psychiatric residential treatment facility model. So to highlight some of the things that we continue to work on, we've offered grants for additional child and adolescent health centers and school wellness programs, giving more access to young people for mental health services in their schools or linked to their schools, because we know that that's an environment where they will reach out and ask for help. Improving access, again, to community-based and inpatient healthcare, which includes establishing those PRTFs, the psychiatric residential treatment facilities, to allow people to transition or step down from inpatient care services to a community placement. We continue to support and encourage the creation of crisis stabilization units as an alternative to emergency departments for people who can be stabilized through treatment and recovery coaching within 72 hours. And then continued focus on our certified community behavioral health clinics, or the CCBHCs, who serve anyone regardless of ability to pay for mental health care or substance use disorder services. We also continue to support the MyCal to focus behavioral health crisis intervention and support for people over the phone. And last October, we launched the Michigan Child and Adolescent Needs and Strengths, or the MichiCANS assessment. So it's a standardized behavioral health assessment process for youth who are entering either the child welfare or the mental health system. Previously, the behavioral health system and the child welfare system were using different assessments, and this will standardize those across the state so that people are utilizing the same assessment and multiple assessments are no longer needed to develop a treatment plan. Well, we want people to be treated in the least restrictive setting possible and as close to home as possible. I know that, and you all know that sometimes inpatient settings are the most appropriate. We have 4 state psychiatric hospitals, and we are in the process of transitioning the operations from the existing Walter Reuther to a new facility in Northfield Township, the site of the previous Hawthorne Center for Children. The new facility will be operational and occupied by the end of next year. We'll have 264 beds, which is an increase of 54 beds from where we were previously. And our fiscal year 26 budget proposal requests funding so that we can transition patients and staff up the new facility. We also know that a very important part of improving access to care is making sure that we have a strong healthcare workforce. Many of you have experienced firsthand over the last 5-6 years this workforce shortage as a result of burnout, low wages, turnover, retirements, and has really created some barriers to access across the state and across the country. This is something that I do continue to have conversations with health systems and others to identify solutions, but we have been able to make some investments here that I think are paying off. We've worked to increase wages for direct and non-direct care workers in recent fiscal years. We've worked to expand the student loan repayment program for nurses and create scholarships or stipends for students who are studying behavioral health. In the last year, we had more than 225 students who benefited from our behavioral health internship stipend program. We've worked to align Medicaid reimbursement rates for non-physician behavioral health care practitioners with those of medical practitioners doing the same services. And we have established grants for continuing education and exam fees for people working in positions where those are required. Progress is also underway to develop a capacity building center, which is a centralized training hub designed to support the retention and recruitment of behavioral health providers and work to improve the quality of services that they are providing. As part of our efforts to improve access to quality behavioral health care, we've recently announced a call for public input as the department moves to a competitive procurement process for our prepaid inpatient health plan contracts. or our PIHPs. The goal here is to increase consumer choice and access to services while preserving our community mental health service programs, or our CMHs, where we know our Medicaid beneficiaries are going for behavioral health care services. At this point, we are just in the initial stage of collecting input from anyone interested in sharing suggestions with us from an online survey tool, which you can find on our website. And I do encourage people to share your thoughts on how we can improve the health of residents who are served by these programs. I'm very proud to say I think we've made very important strides here, and it is critical that we continue to improve access to behavioral health care and support our healthcare workforce. Next slide. We are also working to address the opioid crisis and substance use disorders. We've had some key budget investments to address substance use disorders and the opioid crisis in Michigan. We also know that there are certain populations who may be more vulnerable to the harms that are caused from the opioid crisis, primarily individuals who are less likely to engage with or access services, or who traditionally experience higher disparities in health outcomes. Our response continues to be focused on the needs of people involved in the justice system, pregnant and parenting people, and unhoused individuals, among others. So the current year budget includes almost $300 million toward evidence-based practices in primary prevention, harm reduction, treatment, and recovery support. The opioid response framework is driven by the Opioids Task Force strategy and includes work already taking place and the things that we continue to plan to implement. This work supports evidence-based programming to address and reduce harm associated with opioids. So a few of the things that we have in progress: a recovery incentive pilot, which is funded through 8 PIHPs for Medicaid and Healthy Michigan Plan enrollees to support evidence-based treatments, providing motivational incentives for people who are living with SUDs and are working toward achieving their treatment goals. We have expanded hospital supports for substance-exposed babies and their families. In 2019, we were able to remove prior authorization to prescribe medications that treat opioid use disorder for Medicaid beneficiaries. And since that time, we've seen a 20% increase in the number of those medications being prescribed by primary care physicians. In an effort to remove additional barriers for treatment, we have also provided almost $3 million in settlement funds to expand transportation services for people who are getting substance use disorder treatment and recovery services. We continue to distribute naloxone kits statewide through publicly available ordering system and other distribution channels so that we can reduce the risk of opioid overdoses. And to raise awareness and educate the public, we have a new statewide media campaign, which includes TV, radio, billboards, digital, and social media, and more. In 2026, the governor recommendation builds on this work with additional funding allocated toward prevention, treatment, harm reduction, and recovery programs, including expanding distribution and awareness of harm reduction tools, establishing new recovery beds, investing in the substance use disorder provider workforce, providing transportation. On the next slide, we will talk about enhancing healthcare access and strengthening our workforce. So recently, we've invested in programs that are aimed at enhancing access to care for moms and babies through older adults. We work to continue to strengthen the healthcare workforce. We have increased wages, as I mentioned, for direct and non-direct care workers in recent fiscal years. We've established and expanded the Healthy Moms, Healthy Babies initiatives to provide professional doula services for people with high-risk pregnancies, which includes supporting efforts to train doulas and increase access to services. More families also have become eligible for home visiting programs. We work to ensure that families have the resources they need to decide when and if they want to start a family, and access to other important healthcare services like birth control and cancer screenings. We were really excited to launch the Take Control of Your Birth Control program, which we began at the very end of last year. It offers free contraception resources and supplies to remove barriers for access, like cost, for many people across the state. We use innovative models to ensure access to care is accessible, including our neighborhood wellness centers, some of which began as our COVID-19 testing sites. These are trusted places where patients receive health screenings and meet with on-site community health workers to connect with community resources. They're really amazing community resources located in churches and other community centers in neighborhoods where health disparities are in particular high. And we also have mobile health units to meet people where they are, to offer those preventive healthcare services, and if people need, referrals to other supportive services. We are proposing a revision to the Medicaid spend down program as part of the fiscal year 2026 recommendation. Currently, the eligibility criteria that we're using today is from the 1970s, so last century. This makes it difficult for many people with significant health needs to qualify for Medicaid because their income is over what an unreasonably low limit is. So by aligning the spend down amount to the current federal poverty level, over 75,000 additional people who have significant health needs and whose income was previously deemed too high to otherwise qualify will be eligible for Medicaid. All right. And on the next, we will talk about how we're continuing to. I think we need to go to the next one, actually. These don't seem to be in the same order that I have. That's okay. Finally, we talk about, and I talk a lot about, keeping kids safe. As you know, we are still under federal court oversight on a consent decree from a lawsuit in 2008. So we work to ensure that all of our kids have a safe and loving place to call home, and that has been and remains a priority for me and the department. Our Keeping Kids Safe agenda has policies and procedures aimed at improving the safety and well-being of kids in this state. This agenda is structured around 5 pillars: prevention, intervention, stability, workforce, and wellness. And we are focused on strategically aligning our resources to deliver services and supports with the goal of keeping our families together whenever it is possible to do so safely, and helping families safely reunite. First, I'd really like to highlight the introduction and expansion of what we call our family impact teams, our FIT teams. Every year, the department investigates 70,000 reports of abuse and neglect. We get over 150,000 allegations, but we actually investigate about 70,000 of those. However, we know that sometimes poverty is mistaken for neglect, and one way to address this is to immediately connect families to the information and resources that they might need during child welfare engagements. We currently have 42 family resource specialists in 23 counties, and they have connected families with more than 6,000 economic supports, which includes food, housing, childcare, and employment, and other basic resources. And I am really looking forward to being able to expand the family impact teams to all the counties in Michigan and providing resources for families to safely stay together. Last week, we announced the launch of a new teaming and support model within our Children's Services Administration, which is designed to improve outcomes for families and to support our employees. So instead of one employee being assigned to a family and working independently, employees will have clear and distinct roles and guidance on collaboration expectations to provide support for families from the moment they enter the system throughout the system. And those teams will stay with that family instead of a family moving from silo to silo. These teams, which will include caseworkers, supervisors, family resource specialists, and a number of other roles, will work to address families' needs, whether that be economic, educational, or administrative. Aligning with our Keep Kids Safe agenda, we will be the first state to implement an approach like this. I'm really optimistic and excited about this. I think it's really going to help improve our employee experience, which is vital for me, as well as the permanency rate that we have for families by decreasing the handoffs within the system and increasing the stability of assistance. Another way that we continue to support both the health and stability of families is investing in family resource centers. So again, our goal is to keep kids with their families whenever we can do so safely. And prevention is an incredibly important piece of that work and the work of our partners. Our family resource centers are community-based hubs that share parenting skills, connect families to information and helpful programs, and develop a network of parent and community leaders. The fiscal year 26 budget proposal includes several new programs that are designed to enhance these programs and to protect children and support families. Right now, we have around 10,000 youth who are in foster care, and we continue to prioritize placement with relatives or kinship when possible to sustain sibling ties, preserve community connections, and keep families together as much as possible. The executive recommendation for 26 includes funding to expand our kinship support worker pilot program statewide. So these are roles to help identify potential kin caregivers and then provide supports for those caregivers when they have a relative placement. When children cannot be placed with relatives, we rely on foster parents to step in, as you know, and provide care for children. Recruiting foster parents is a challenge. It is especially difficult when it comes to placing youth who have very complex medical and behavioral needs. Knowing this, we are requesting funding to create a professional foster parent program, which would bring on 30 paid foster parents who are trained in healthcare and other relevant services. This would allow a small cohort of our foster parents to dedicate their time and attention solely to foster parenting without sacrificing their ability to earn an income. In addition to professional foster parents, the 26 budget includes funding for enhanced treatment foster care to bring intensive services where youth are. And once a child is adopted, we want to ensure that the adoption remains stable and that families have access to a range of services. So we are requesting Medicaid support for any child in the Adoption Medical Subsidy Program, and that supports medical, mental health, and emotional treatment for adopted children throughout their childhood. Finally, I'd like to just give you a brief update on our efforts related to juvenile justice. Michigan has 2 state-operated juvenile justice facilities, Shawano, which is located in Grayling, and Bay Pines in Escanaba. We are in the process right now of closing the Shawano facility and moving that to a new treatment center in Macomb County. The Michigan Youth Treatment Center will have 60 beds once it's fully renovated and staffed. This is technically 20 more beds than we have at Shawano, but functionally it is 40 more because we are only able to staff for 20 beds at Shawano currently. So the budget recommendation also includes a proposal to align funding with the new facility. And we continue to implement recommendations from the Michigan Task Force on Juvenile Justice Reform. The task force made recommendations to safely reduce placement in detention or residential treatment facilities, to work to reduce disparities among kids in the system, and improve coordination between all of the partners in the system. Successful initiatives implemented so far include increasing the rate for community-based services and using a needs assessment, again, a standard assessment, to determine where and what services adjudicated youth should receive. Looking ahead, we will further implement recommendations of the task force, like developing alternatives to detention, establishing a community-based continuum of care, and providing youth incentives. So I think there might be one more closing slide. I don't know if there's anything on it. The priorities and initiatives that I covered today are moving forward, not only because of the continued work and dedication of the department, and all of our employees, who I am deeply grateful for, but also thanks to so many of our partners across the state. Accomplishing these things is the work of our thousands of employees at the department, from local governments, nonprofits, hospitals, and health systems, our FQHCs, our health plans, our mental health authorities and partners, providers, and so many other people. So thank you for everything that you do and for all of our partners that are represented here today. This work is not easy, but I do believe that we have exciting opportunities to enhance the health and prosperity of all of our friends and families across the state for generations to come. I really enjoy and look forward to continuing to work with all of you. And with that, I am happy to open it up for questions.
Well, first of all, thank you so much, Director. We really appreciate all the information you shared. And as you mentioned, there's quite a few folks on this webinar today that have been partners with the department. I'm very grateful for your leadership and your ability to tackle these really difficult issues, because I know that these are not easy and there's a lot of moving parts with all of them. And I want to encourage our folks that are listening to drop any questions in the Q&A box. It's not in the chat. There's a Q&A button on here. But in the meantime, I did have a couple of questions that had come in even prior to getting on this call, if you don't mind indulging me for a second. One thing that's just for us insiders as part of this budget process as it moves forward, with the changes that have taken place in the legislature, how are things going for the department with the DHHS budget being broken into 3 subcommittees in the House and 1 in the Senate, and kind of bringing that all together through what could be potentially a longer process this year?
So far, it seems to be working. We're a little busier because we don't have as much time between committees. We have, actually all 4 subcommittees are on the same day. However, I am really grateful to Speaker Hall, because I think his concept here was that we have such a broad and overarching budget, and we really do. It can be very overwhelming to break that up into different parts so that people would really be able to learn and establish some expertise in different areas. I think that's a great idea. And I hope and I think that the members are really excited for that as well. So right now, again, it seems to be working just fine. When we get to a point where the department and the chambers enter into negotiations, I'm not quite sure how that's going to work. I'm not sure that they know how that's going to work yet either. But we'll stay flexible and do whatever it is we need to do to help support them in making the decisions that they'll be making and providing the information that they need.
Excellent. Well, this question had come up prior to the call and actually just popped up on the Q&A. And it's probably not a fair question, because I think all of us are kind of waiting to see how this is going to work. But with the changes happening at the federal level and funding differences in Medicaid in particular, how does the how's the department preparing? How do you see that working? What are things that some of our providers should be doing to plan?
That's a really good question that we've been asking ourselves, and I know other states and providers have been asking themselves. We don't know. And we won't know until we do know. And I don't know when that's going to be. In the interim, we have made sure that we're running the scenarios that have been discussed, whether that is rolling back the expanded or the enhanced match rate for Medicaid expansion population, whether that is the implementation of work requirements. There have been a couple other things that have been discussed to make changes to the Medicaid programs so that we can understand what the reductions will look like. In every scenario, they are significant. And in every scenario, it does not seem feasible that the state would be able to fill in the funding that would be cut from the federal portion. So we would be looking at some reductions at the state level. What those look like, we certainly haven't had that discussion yet. I don't know whether that would be trying to look at different benefits, whether it would be eligibility, whether it would be rates. I really don't know. And a lot of that is dependent on the extent of the reductions at the federal level and the um, the work of the legislature as they go through the budget process.
I think we'll all be probably we're all in this together, and we'll certainly keep an open dialogue as this changes. And we appreciate your willingness to continue to have those conversations. One other thing that had come up, through the pandemic, and you referenced this a lot in your presentation, so I apologize for some of it being a repeat, but also kind of want to hit the intricacies of it with the workforce shortages that happen, particularly in the provider space, and all of the work that the department's done to support that, but enhance it. Do you feel like it's level setting? Do you think things are getting better? Are you still hearing a lot of those same concerns from providers?
I still hear a lot of the same concerns from providers, and I just want to remind everybody here that we are also a provider. So we've felt those difficulties as well, as has corrections. So this has affected state government, probably other levels of government as well. I will say, though, that the investments that the legislature and the governor have supported over the last few years have been very useful, and we will see the effects of that in the coming years. But every dollar that we have for state loan repayment or the internship stipends, they go immediately. And we have so many people who apply for those. So we know that there are people who are going to enter the field, and we know that they're taking advantage of uh, the benefits that we have available. And we'll continue to try to do that. I have continue to have concerns on like the direct care worker and the non-direct care worker level, especially with the minimum wage increasing and kind of eclipsing what we were able to do previously. So those are always very challenging roles to fill, regardless of the salary, just because of the work that's being done. But we'll continue to keep a dialogue with the legislature and other providers to hopefully enhance plans that really bring people into the workforce and then allow them to go through a career ladder, essentially, with beginning at a direct care level and then continuing education and training. I can't hear you. Sorry.
Sorry about that. We just
No
had one
problem.
question pop up in the Q&A from Jody Radke, and she's with the Campaign for Tobacco-Free Kids. And she wanted to first thank you so much for all of your work, and wanted to ask, you mentioned a focus on opioid prevention and substance abuse generally. Does the department have specific prioritization related to tobacco control and efforts to hold retailers accountable, while removing penalties on kids for purchase, use, and possession, given that tobacco use is the leading cause of preventable death and disease in this state, and Michigan's use is escalating?
The governor's executive recommendation does include a new vaping tax, which is something that we don't have in this state yet. All of the surrounding states around us do have a vaping tax. We know when it comes to tobacco usage among young people that the tobacco usage has remained relatively stable, but where they're getting that tobacco from has changed. So cigarette usage has gone way down, vaping has gone up. We believe that being able to implement that type of tax will really help to deter people from continued use of vape products. And the implementation of that tax would also allow us to enhance our surveillance, our tobacco surveillance program, so that we can hold retailers accountable.
Thank you. I just want to send out another call to anyone that has questions, so to please put them in the Q&A. So thank you for those that have submitted so far. One thing that I just wanted to ask was, I love all the great plans that you guys have for 2025 and beyond, and it's really impressive to see how much work the department has already done under your leadership. And what would you say is your number one goal to get completed, within the next year or so?
I would really like to see the full implementation of our child welfare teaming staffing model. As I continue to learn more about children's services and the child welfare programs, I was really struck at how outdated I think that those programs are, the models are. I think all of the people that work there are very dedicated and very passionate. One of the things that I've said repeatedly to my team is, child welfare, becoming a child welfare worker is not something you fall into. It is something you went to college to do. It is something that you are seeking out. And it is our responsibility to make sure that we provide them the support to do that. Because it is a finite population of people who want to go into that work. When we looked at how the child welfare program has evolved, I started asking some questions like, hey, when was the last time we looked at these position descriptions and updated them? And the answer was, we have no idea, which means never. So we are working on a child welfare system model that was developed probably in the 1970s and the 1980s and hasn't evolved with the way that we work. There's almost no profession anymore where people, especially some sort of service profession where people work individually. We've seen the transition in the healthcare sector to more of a team-based focus, and that is really, I think, going to be something that will change the full experience of child welfare for our families and for the people that work for us. We've already seen some of the benefit of that with the family impact teams and the kinship care models. We've done 6 counties where we focused on permanency, increasing our permanency rates. And we've increased those rates in 9 months in a way that is quite staggering compared to what we were doing before, by really bringing in a group of people to focus on those other factors that are barriers to families staying together safely. So I'm really excited about that. I would really love to see us continue to move toward exit from the consent decree. I think we've made incredible progress in 15 years and in the last couple of years on some of those harder to move metrics. And I'm really excited that we've been able to bring the new Medicaid health plan contract online. And I am just as eager to see how the PIHP RFP process goes. I think getting that input from the general population is really going to help us design something that works for consumers in a way that things maybe don't right now. So we have there's always a lot of things going on, but I think those would be the 3 biggest that I'm excited about.
That was speaking of the health plan contract, that was super interesting. I know it impacted a number of our clients, even looking at it from the sustainable food models and things like that, that were, just very creative and a change in improvement for the patient access and just overall experience with the department for sure.
And a lot of that really was the result of asking people to tell us what they thought we should be doing. So having the sort of the direction coming from outside of the department, from users of the system or providers in the system, I think really resulted in a better RFP and a better contract.
I think that's really meaningful to folks as you and your team travel across the state and have the listening sessions as well. I know your team has been all the way up to the UP, down to Southeast Michigan, over to Southwest Michigan. Are you planning another trip like that this year, just to visit with everybody? I'm sure that gives everybody on your team a better perspective, just seeing how a lot of the programs you developed are executed.
Well, given that I'm now the director, I get to do that stuff whenever I want. So
Love
I
it.
do. That is probably the best part of having this job now, is really getting out and being able to talk to people who are implementing the programs, the people who do get the funding from the budget, and really seeing how those things are working. I will say it's always amazing to me that we still have problems in the world when I meet with these organizations who are doing such great work, and we'll continue to advocate on their behalf. But yeah, absolutely. And if there's anybody on this webinar who would like to have me or anyone from the department come and visit, you can contact our communications department and make a request. They always have an ongoing list for me of different places that I can go and visit and learn about what people do.
So as the public health emergency wrapped up, and I know this is going to be something that's dependent on, how things work out at the federal level, but did you see a drop in Medicaid enrollees, or did it kind of one for one trade with new people coming online with people dropping off?
When we went into the public health emergency, part of the requirement at the time from the federal government was you couldn't do redeterminations while we were under the public health emergency. So if somebody qualified for Medicaid, they stayed on Medicaid, which is not how we normally function in Medicaid. We redetermine every year. We saw the enrollee number increase by almost 1 million people, which means that the safety net worked when people either were laid off or were underemployed during that initial time in 2020 and began qualifying mostly for Healthy Michigan. We started covering them and picking them up. As people then began to go back to work or were called back to work, they were still on Medicaid because we weren't doing those redeterminations. So when we did the redeterminations over the last year, we did see a number of people fall off. It was right around the number that I thought we'd see. I will say, in this process, you probably will go down a little bit more because redetermination is dependent on people, sometimes people getting enrollment forms and applications in, and sometimes people don't always do that, or we didn't reach them. So we'll probably see the numbers build up again just a little bit, but not nearly to the level that it was. So I think we're right about where we should be right now with our eligibility categories in the state.
Well, I really appreciate all your feedback. I think you've answered all of the questions that we had pop up from the guests watching today. With that, are there any other words of wisdom you'd like to share with us today?
I want to say thanks again for asking me to do this. It's always really nice to talk about the good work that we do. As you can tell, I can talk about all of these things for a very, very long time. I really do, I think, as you all know, enjoy this work and enjoy working with all of you. And if there is anything, as you know, that we can help you with, please don't hesitate to reach out. I'd love to come and see what you're doing in your communities. And I hope that you all enjoy this St. Patrick's Day and Monday and the sun. So thank you. And thanks again, Carrie.
Thank you so much for being here. We really appreciate it. Have a great
Bye,
day.
everyone.